Good day, I'm Dr. David Ajibade with the Brain and Body Foundation, and it's my pleasure to talk about nutrients, malaria, and the immune system. And I think in this particular COVID-19 season, the importance of the immune system has been really highlighted. From what we've seen, those who have weakened immune systems or those who have dysfunctional immune systems, whether they are old, obese, have cardiovascular system or not, is those who have something going on with the immune system. Those are the ones who tend to have the more severe forms and who tend to die from COVID-19. And so it's extremely important. And we've been talking about the immune system and health for quite a while now. And as a matter of fact, in our foundation, we found out with our works with kids with asthma, brain disorders, sickle cell disease, we found out that simply improving and strengthening the immune system can go a long way towards those diseases that I just mentioned and in several other diseases as well. So it's really important that we understand the nutrients and the factors that influence the immune function. And of course, it's not just about nutrients. Of course, our diet, our emotions, stress can play a huge role. Our exercise or lack of exercise can affect the immune system. But since we're talking about nutrients and the immune system, we're going to stick with that. And in the area of malaria and the immune system, I think it's pretty obvious that those who have a good diet, who tend to take supplements, who tend to take extra nutrients, tend to have, shall we say, better prognosis when it comes to malaria. I mean, everybody has malaria from time to time, but it seems that those who have a more optimized diet tend to have a less severe form of malaria, and they tend not to have it as long as those who otherwise do not have a well optimized diet. So it's really important that we understand the specific factors in nutrients that help to strengthen the immune system. I think I have to say that we lacked this in our medical school training. I don't think we paid as much attention to the nutrients, specific nutrients and how they can strengthen the immune system. But this is a good time for us to be able to educate not just the lay public, but healthcare professionals at large all over the country as to the importance of the immune system. Now, speaking about malaria and COVID-19, we know that they share similarities. Certain areas, symptoms, fever is common to both. We know body pains, chest pains are common to both. In some cases, malaria patients have sore throat as well. So that again, it takes you to COVID-19. So people are sometimes confused as to whether this is malaria. And my recommendation is always this, that they go ahead, do a blood test, do a COVID-19 test. Now that usually takes about 1-2 weeks to return. So during that wait period, it's important that they strengthen their immune systems. And some of the nutrients and the foods that we have known, that have shown to be effective in strengthening the immune system are the whole foods like the ginger, the garlic, honey, lemon, and other foods containing vitamin C. And of course, the more herbal things like dogon yaro. Specific nutrients like supplements like vitamin C, very important. Boron, zinc, and omega-3 fatty acids are also very important as well. There are other minerals and vitamins which we'll talk about, but these seem to stand out, especially zinc in this COVID-19 period, because zinc specifically targets the virus and can also disrupt the viral replication. But it's important that people again understand that your nutrients, good nutrition or lack of good nutrition, can affect your health, and it can affect whether or not you get malaria and how long that malaria lasts. So I think there's that gap that needs to be filled. Also, when we're talking about COVID-19, I want to refer to some studies that have come up all over the world about a specific nutrient which seems to be more lacking in black people all over the world. As a matter of fact, to the degree that they say that in some countries like the UK, they found that the black people tend to die 4 times as much. They are 4 times as likely to die from COVID-19 as white people. Now we know there are factors like black people tend to have the more essential jobs, and they're out there more often, and of course the lower income paid jobs. But it goes beyond that, because they've now studied a specific nutrient. They found that this nutrient is lacking in many black people, especially those who are indoors a lot of the time. So why is this nutrient important? Well, it's not just about a correlation. People say, well, it's just correlated. That's not the cause. But if you consider the fact that this nutrient is important for protection of the upper respiratory system, and that's, of course, we know it's through the nostrils and through the mouth that COVID-19 enters the body, and of course through the eyes. But this nutrient protects against that entry. In addition, it protects the lungs from invasion. So if this nutrient is lacking, then there will be a problem. In addition, this nutrient is extremely important to calm down the body's immune reaction to the virus. And as we all know, most, if not 98% of the cases of death and severity from COVID-19 are due to the body's own immune system attacking its own tissues and cells in a bid to destroy the virus. And that, in the final analysis, is what kills patients for the most part. We know that in most cases where there has been death, and in severe cases, is because this nutrient is lacking in the body. And that, like I said, this has been reproduced. This study has been reproduced all over the world. So it would be an honor and a pleasure, really, to work with you in educating, in training healthcare professionals about how to strengthen the immune system, how to protect against malaria. Of course, the medications certainly and always will have their place, but the medications do not strengthen the immune system. They attack the germ, the malaria parasites. We also need to be able to strengthen our immune systems so that they are be able to form a wall of defense, so to speak, against the invasion and the development of the disease in most of us. So thank you for listening, and I hope we can explore this further. Again, this is Dr. David Ajibade with the Brain and Body Foundation.
This time is also 7 minutes.